and today we will be discussing several pulmonary congenital disorders. Congenital means something is present at birth. All of these disorders are affecting fetuses or continuously affecting newborns. Some congenital disorders aren't noticed or diagnosed until later in life, such as benign masses, and many congenital disorders are considered to be anomalies. Medically, we don't know why they occur or how to prevent them. Let's get into it. I believe to understand many of these disorders, you have to discuss normal fetal respiratory development. There are 5 stages or benchmarks in respiratory development, starting with the embryonic stage. This begins around 4 to 7 weeks. At this point, the development of the fetus's trachea and bronchial buds begin. This starts as an outpocketing from the foregut endodome called the respiratory diverticulum, or lung bud, which separates from the digestive tract to develop into the tube-like structure of the trachea, and bronchi eventually evolve into the lungs. The next stage is the pseudogranular phase. This is roughly 7 weeks to 16 weeks. The bronchial tree branches extensively begin forming secondary and tertiary bronchial buds, beginning the granular structure with no recognizable alveoli. Not just yet. Next is the cannulicular phase. This spans from week roughly 16 or 17 to 26. During this stage, the basic structure of the lungs form, and vessels fill the space. The respiratory tree expands in length and diameter. Terminal bronchioles divide into respiratory ones and alveolar ducts, and later alveolar saculi. The main characteristic of this phase is the alteration of the tissues of the lungs. The spread of capillaries happens simultaneously. Next is the saccular phase. During this, the alveoli mature and surfactant begins to be produced. Surfactant is very important. It maintains surface tension to keep the alveoli inflated. Without surfactant, they would collapse, and this would cause a reduction in surface area after you respirate, after you breathe out. Surfactant is very important. Moving on, we'll see the final phase, the alveolar phase. This begins around 36 weeks, and it continues post-birth. This is where everything finishes maturing and begins preparing for your first breath. And then down here at the bottom, I have a mnemonic for easy memory of the 5 stages. Every pulmonologist can see alveoli. And then I've put several different pictures here to help visualize what's happening. Moving on. Now we'll be moving into the congenital pulmonary disorders we will be discussing. Here we have bronchiogenic cysts. They are one of the 4 general types of congenital lung disorders we will be discussing. Bronchiogenic cysts are one that is described as abnormal growths of tissue that form in the mediastinum between your lungs. And the symptoms involve infection, fever, breathing problems, trouble swallowing, cough, wheezing, but you could also not experience any symptoms. This is one of those congenital lung disorders that people sometimes don't realize they have until much later in life. And typically, they could also just be removed if causing issues, but sometimes they're left without any medical intervention. Most of the time, they are just benign cysts that don't cause a whole lot of problems. But of course, treatment choices is watching, taking note of them and watching them, and surgically removing if there's a problem, or just draining them. Moving on. Next, we have congenital cystic adenomatoid malformations, also known as CCAM or CPAM. What are they? They are benign lung lesions that appear before birth as a cyst or mass in the chest. They're made of abnormal lung tissue that doesn't function properly but continues to grow. They can be very life-threatening. Sometimes they don't get too big, and the small lesions are called microcystic, and they can be monitored and just removed after birth. However, large CCAMs are called macrocystic, and they can be very life-threatening. If treated early and watched, microcystic can be taken care of after birth. However, if they go undiagnosed, they can lead to fetal heart failure and maternal Muir syndrome. Typical diagnosis is by a prenatal ultrasound, and management during pregnancy can consist of steroids, draining fluid from the cyst, or even open heart or open fetal surgery. Okay, moving on. Next, we have lobar emphysema. Lobar emphysema is a rare developmental anomaly, also called congenital alveolar overdistension. It manifests as hyperinflation of one or more pulmonary lobes due to an airway obstruction. And weirdly enough, they are actually more common in male fetuses. This condition can lead to respiratory distress, and a treatment typically involves surgical intervention to remove the affected lobe or lobes to improve lung function. There's not exactly an exact reason why, but there are several theories, and just to name a few, ball valve obstruction in an airway could lead to this, or airway collapsing when the fetus first breathed out. Moving on. Next, we have pulmonary sequestration. What is pulmonary sequestration? It means that it's a condition that means there is a non-functional segment or lobe of lung tissue that doesn't communicate or receive blood from the rest of the tracheobronchial tree. The most common clinical presentation is recurring pneumonia in that specific segment of the lung. And actually most people, or most situations, call for a complete pulmonary lobectomy after stabilization after birth. Moving on. Now we just spoke about the four most common types of congenital pulmonary disorders found. Let's talk about one that is extraordinarily rare. Pulmonary agenesis. Pulmonary agenesis is very rare. And this is just one of several very rare birth defects and conditions. This condition is characterized by the underdevelopment, incomplete development, or complete absence of one or both lungs. Unilateral agenesis isn't always fatal. However, if a fetus isn't developing properly and doesn't develop both of their lungs, it is always fatal. People can survive with only one lung. However, it causes a lot of stress and strain on their body, and later in life, it is typical that they will have significant other issues. This birth defect, in the few cases, broadband, have always been associated with having additional congenital disorders. Not just lung congenital disorders, but other bodily congenital disorders. Thank you so much for listening, and I hope that you learned something. Bye now.